go.
All right. We're going to give a few people time to join us as we get back to our webinars, regular scheduled webinars. Just want to welcome you back to NMQS Friday webinar series. And if you know anything about us, you follow us normally, you know the last Friday of the month is typically reserved for our Center for Sustainable Healthcare. So, and I just asked her this, but Chinnie Ukachukwu?
Yeah.
Sorry, and she's been here at NMQ for 3 years, and I am that bad that I still messing up names, but I do know her work and know that she does. I may not know how to pronounce the name the best, but I do recognize her talent and her work. And so I want to appreciate her for what she's doing and leading today's program. As I just said, Chinnie's been with the NMQF team for 3 years and always worked with SHC, really working on getting us out in community and our focus directly with people. Before I turn it over to her to lead today's webinar, I just want to do a couple of housekeeping announcements. One, if you have any questions that you want the panel to ask, please put them in the Q&A box below. Two, if you want to have some chat and have something that you want to talk about or bring up to just everybody that's participating, please use the chat function. That's all I have, and I'll turn it over to much smarter people. And Chinnie, you can go ahead and lead this webinar.
Absolutely. Thank you so much, Brandon. Really appreciate your the introduction. Hi, everyone. Happy Friday. Thank you so much for joining us today on our webinar. My name is Chinnie Ukachukwu. I am the Senior Director of Quality and Improvement at the Center for Sustainable Healthcare, Quality and Equity, one of our business units here at the National Minority Quality Forum. And it gives me great pleasure to be having this conversation. Today's the 31st of May, but we're on the threshold of the month of June. And June is Alzheimer's and Brain Awareness Month. And so we're going to be talking about something today in honor of that. So we're going to be having a conversation with two amazing panelists about understanding Alzheimer's disease, the importance of driving involvement in Alzheimer's disease research and advocacy, addressing health equity concerns in Alzheimer's care, and gaining insights into community-based initiatives and caregiver support. Before we start the conversation, I'd really like you to join me to welcome my two amazing panelists, who I'm going to read their short bios to you, just to shout out the work that they do. First on my list is Marcia Hen, who is the Memory Advocates Peers, or MAP Program Manager and Director at the Caring Kind, the Heart of Alzheimer's Caregiving. Marcia is a seasoned program director with strong expertise in crafting and executing organizational strategies. Her profound knowledge and experience in leading new initiatives in Alzheimer's disease and related dementia stem from her personal journey as a caregiver to her mother who battled Alzheimer's. This life-altering experience inspired her to shift her career focus towards supporting people living with dementia, their caregivers, as well as caregiving services, where she dedicates her expertise, passion, and efforts. She's committed to driving success and continuous improvement in services for those afflicted with Alzheimer's disease and those who care for them. Welcome, Marcia. Thank you for joining us today.
Thank you very much.
You're welcome. Also with us today as a panelist is Mr. Augusta Green IV, who is the director of the Joe Samuel Ratliff Lifelong Learning Center in Houston. He is a native Houstonian, and his education background includes a Master's of Science in Leadership from the Grand Canyon University Ken Blanchard College of Business. As director of the LLC, Mr. Green and his staff of 7 are responsible for balancing the schedule of events on the Brentwood campus. His dedication to excellence and his passion for flair are the ingredients that have helped the LLC building become another thriving community beacon to the Brentwood Baptist Church campus. He is the facilitator for the book club, catering, love ministry, scheduling, the cancer support ministry, senior adult ministry, and the wellness ministry. In addition to his work at Brentwood Baptist Church, he is also the chairperson of the Brentwood Community Foundation Scholarship Committee, a board member of the NBLIC, which stands for National Black Leadership Initiative on Cancer, and the RCMA, which stands for Religious Conference Management Association. Welcome to you too, Mr. Augusta Green.
Thank you. Thank you.
Thank you for joining us today. All right. Now we're going to really dive into a conversation. Like I said, June is Alzheimer's and Brain Awareness Month. But just as a background, the National Institute on Aging defines brain health as all about making the most of your brain and helping reduce some risk to your brain as it ages. I would ask both of you, can you share from your experience what you see as a difference between brain health generally and mental health? Because I'm asking this question because a lot of people would use it synonymously, but in your experience, would you say there is a difference? And if there is, what would you say? I'll start with you, Marcia.
Thank you, Chinnie. Thank you again to the National Minority Equality Forum for having me. Yeah, there is definitely a lot of talk between brain health and mental health nowadays. And I'm very happy to know that because we are definitely addressing something that needs to be addressed. Brain health is being free of disease to me, being free of anything that is not allowing you to function as you normally would be functioning. Mental illness is something that is affecting your thinking, that is affecting your feeling and your behaviors and your moods.
Okay.
And to me, that's how I would describe it.
Okay, fair enough. Thank you so much. Augusta, do you have any difference, anything to add to this?
No, I agree with her on that one. Yes, I'm fine with that one.
Okay. All right. So now specifically speaking, how would you describe Alzheimer's disease? Oh, Augusta, you want to start?
Okay, Alzheimer's degree itself is basically when you look at various memory issues, Alzheimer's degree to a certain degree in our community or in the medical field, they deal with the disease. It's part of aging. Some people, the misconceptions come in play so often when we come together. The misconception of just thinking it's a normal part of aging, or it's an early onset, only affects the elderly. And so we counteract that and deal with the strategies to address and dispel those misconceptions, such as through education and awareness. So we first deal with the fact of what it is and what causes disease. And a lot of people so often go to the extreme and saying there's no way to improve quality of life, or the patients being incapable and should be isolated. They have those misconceptions. So again, with the training, the advocacy work, and the support groups, we counteract it and give the instructions or where we go from here, if that
Okay.
makes sense.
Thank you so much. Marcia, can you talk to us about Alzheimer's disease?
Yes, I would agree, with what Augusta just said, right? I think the way I would describe it is definitely Alzheimer's disease is a degenerative, brain disease that is at the time irreversible. And as I think, as Augusta was saying, there's a lot of misconception with Alzheimer's disease, and I'm really happy to know now of all the advancements that has been made in the last several decades to bring awareness, because in these misconceptions, there is so much stigma tied to that. And we have to really kind of break that down. And hopefully we'll be speaking a lot about that in the next hour, to really break it down, to understand these misconceptions, to understand the stigma that's tied to it. Because education is really the power that we have in order to kind of understand it, learn about it, understand it, and break down these stigmas. Yeah.
Thank you. Thank you. Just for the record, I just wanted to point out that Mayo Health describes Alzheimer's as the most common form of dementia, a brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest of tasks. I know that when we were speaking earlier, Marcia, you talked about dementia. And so I wanted you to just kind of give us a difference or point out the difference, if there is any, between dementia and Alzheimer's based on the work that you do.
Yeah, absolutely. It's a great question, actually. And that's one of the questions that I often, in doing some community building and community education, it's one of the first things that I like to speak about. It's just clarifying the difference between dementia and Alzheimer's. Many times it's used interchangeably. So dementia is really actually not a disease. It is a term that's used to describe the different symptoms that that basically signify memory loss, reasoning, logical thinking. And so there are many, many different types of dementias. Alzheimer's happens to be the most common form of dementia. And Alzheimer's is an actual disease. It generally, when you see dementia, about 60 to 80% of those persons have Alzheimer's disease.
Okay, thank you very much for that, for clarifying that. Now, I would like you to, still to you, Marcia, talk to us about the work that you do at Caring Kind. Any key initiatives or programs that you have, especially that's targeted or focused on people living with Alzheimer's disease.
Sure. Yeah. Caring Kind is an organization that has been around for a little over 40 years, actually. We actually were a part of the Alzheimer's Association. We were the New York City chapter office. We now stand, again, for a little over 40 years as an organization that provides programs and services to people living with the diagnosis and their caregiving families. We provide many different services and programs for both of them. And those services include primarily education. And education, really, I can speak quite vastly about the education, because there's education for the care partner, there's education for the person living with the diagnosis. There is education in the form of, like, we provide also seminars like legal and financial seminars that help to guide the care partner in the direction of what do I do now? How do I attain a power of attorney? How do I get a healthcare proxy? So our education department is really vast. We have an early stage department, which has launched once again about 2 years ago, quite strongly. Actually, the program that I manage happens to fall in that department of early stage. In that early stage, we provide cognitive stimulation therapy programs, support groups for the person living with the diagnosis and for their immediate partners. The program that I manage, the MAP Memory Advocate Peers program, which is a program that basically it provides a mentor to a recently diagnosed partner, person and their partner for 1 year. Now, that mentor happens to be a former caregiver, so they have lived experience, they understand communication and how to best address the person that's a care partner as well. In Caring Kind, we also have a Wanderer Safety Program, which is a program that works together with the Medic Alert, which is a national organization for when persons living with the diagnosis become wanderers. They get lost in their neighborhood. They have disorientation, and it's through either a bracelet or a necklace or a watch. But we work together with the NYPD as well. So we have that program. We have a cultural program, which is called Connect to Culture. It provides families and persons living with the diagnosis opportunities to attend all types of cultural activities in New York City. So be it museums or botanical gardens, or the Intrepid Museum, or all types of music and art activities. We have support groups. We have, like I said it before, education. We have so many programs, and
I see.
I can tell you that I'm a very proud. I speak fondly of it and largely of it because in every aspect of the person with the diagnosis and their care partner, there is a service or a program that we can provide to them. And it's we're you know, one of the leading experts of Alzheimer's in New York, and I'm happy to say this is probably why we've been around for so long. So that's in a gist or in a nutshell what Caring Kind is.
Amazing. Thank you so much. So quick question. We can move to Augusta. Is the program, I know you talked about all these beautiful things working in conjunction with the NYPD. Is it safe to say that the program is just for folks? Can you hear me?
No, you cut
Hear me?
out.
All right. So I said, can you hear me now?
Yes, I can. Right.
So you were talking about the program working collaboration with NYPD. Is it safe to say that Caring Kind only works in New York, or can you provide resources? Oh man,
There's something going on.
I'm going to turn my camera and try. Okay.
Yeah.
How about now? Can you hear me?
Yes.
Is it better?
Yes, that's much better.
Okay. So, Marcia, you shared information about working creatively with NYPD. I'm asking to see that Caring Kind only works in New York, or are you able to provide resources to folks outside of New York?
It was a little cut out, but I think I heard the last part of it. So I think you asked if we're only providing services in New York. So actually, we provide most of our services, actually all of our services currently virtually as well. Obviously, since the pandemic, we provide all of these services virtually. I personally have clients in some of them in Europe, and in other states of the U.S. So we definitely provide services as long as the person can, you know, have a telephone or a tablet and, you know, a desktop in order to be able to receive the services virtually.
Okay, great. Thank you for sharing that. Augusta, I know that you all have a rich program at the Baptist. Tell us a little bit about your Alzheimer's ministry. And what you do.
Okay, the Alzheimer's Ministry Gathering Place is what we so call it. This program was started in 1994. It grew out of the need for support systems that were lacking in our Black and Brown communities. Dr. Ratliff, our pastor, gave his permission to start this Gathering Place program at Brentwood Baptist Church, again, 30 years ago. A presentation was made to the pastor on the importance and benefits that what the program could provide. And it was to help support the church members and the community at large. Actually, Brentwood became one of the first Black churches to offer this program because many Black churches was not offering support programs as such. It grew out of a need, and this need, we're an aging congregation, if you will, and the Gathering Place program was offered under an umbrella of an organization called Interfaith Ministries, which is now called Care Partners. And this nonprofit organization that has now, again, as I stated earlier, became the nonprofit organization called Care Partners. So our Alzheimer's ministry initially focused on providing in-home respite, if you will, to persons with dementia and other memory related issues, referred to as care partners, who were being cared for by so often the family member, who we also call the caregiver. So realizing most caregivers prefer to maintain their privacy at home rather than have volunteers come into their personal and private lives or their homes, the program provided on-site respite at our Brentwood Lifelong Learning Center, which is a 75,000 square foot center on the campus of Brentwood. So once a month, we carefully chose volunteers and that was trained by that organization, Care Partners, in the specific areas such as memory issues, again, And they also receive training on developing the Gathering Place program itself and its agenda, and how to interact with and conduct activities with the care partners. So 30 years later, the on-site respite organization itself still continues. And on the fourth Saturday of each month, these caregivers can now enjoy at least 4 hours of well-deserved relief. So often we call it me time, if you will. And these 4 hours knowing they can leave the church or leave the campus, knowing that their family members are in good hands with our volunteers. And so right today, we continue that program once a month for 4 hours on a Saturday.
Amazing. Thank you so much for sharing. That is so amazing to know that a church has been doing this for the past 30 years, supporting
Yeah.
people with Alzheimer's disease. Thank you. Thank
You're
you.
welcome.
Marcia, I want to go back to you and ask you a question. In working with people who are either living with Alzheimer's disease or caring for those who live with Alzheimer's disease, what are some major challenges that you have seen, especially around social determinants of health, insurance status? What are some challenges you've seen associated with diagnosing patients with Alzheimer's disease?
Thanks, Chinnie, for that question. And congratulations, Augusta. That sounds like an amazing program. It's basically some of the work that we are slowly beginning to work with with MAP, with the program that I manage here. And it's working with underserved communities because we see the need, which leads right into your question, Chinnie. Some of the things that we've really struggled with is really seeing how we are not, for this particular program that I'm speaking to you today about, which is the Memory Advocate Peers Program at Caring Kind, we receive, referrals of people that are recently diagnosed in the early stage. The reason is because we want to be able to have this particular person that has been recently diagnosed and their care partner, their caregiver, be mentored by a former caregiver. In order to do that, obviously, we are looking for somebody in the early stage because we want their feedback. We want to understand what are their needs at this time. And we also want to be able to provide them the emotional support that they need, the guidance to local resources, to teach them and ask them, maybe they might know a little bit about clinical trials, but really to just have them speak with a clinical trial mentor that is the founder of the program, Jim Taylor, and to have them understand the importance of clinical trials. Now, in the 2 years that we have launched this program, you can very well imagine that the referrals that we have received, speaking about disparities, are not necessarily of African Americans or Latinos. I am a Latina, I am a former caregiver, and I understand exactly what that is to, have a diagnosis of your loved one and not know where to go or not know of any services that are available. And at the time, you're feeling like, do I really want to look out for services? This is so outside of our culture. This is not something that we normally would do. We try to keep it within our family, within our home, within our circle, and within our village. And it's really hard when you don't have anyone that looks like you, sounds like you, talking about it. So some of these, disparities when it comes to, underserved communities, underrepresented communities, you are going to have so much stigma. You're going to have so much misunderstandings, misconceptions, like Augusta was speaking before, of where you can go, what you can do. Generally, African Americans, Latinos, do not have the health coverage that they may need, do not have maybe the proximity to doctors, medical offices, they have maybe language barriers. Mm-hmm. They may have, there are so many different barriers, but I think that oftentimes it really just boils down to the cultural barriers of not being able to feel the trust that they can go to a medical facility or a doctor where they can speak openly. If the education is not there to start building on that, then this is where we're struggling.
Yeah.
Yeah.
Yeah. Thank you so much, Marcia. Thank you. So many important top points that you touched on. I'm just going to leave that unpacked for now as we slowly get into the conversation. All right. So Augusta, back to you. You shared about this amazing ministry that you have going on at Brentwood Baptist Church that's for the Alzheimer's, called the Alzheimer's Ministry. Can you tell us a little bit about what inspired this program and how you have maintained it? You said 30 years now. How have you been successful at keeping it going to, growing the sustainability for 30 years? That's a big achievement. How did you all do that?
Well, as I stated earlier, the inspiration grew out of a need. And the inspiration itself was the community needs. With again, with the majority of an Asian African-American congregation, educational healthcare disparities, all that played into a role. And that remains today. Let me share that with you. And that remains today, still the disparities within our communities. And the health issues alone, with the lack of knowledge, it took a great, my pastor is very passionate, if you will. And so when this program was introduced 30 years ago, we want to jump on top of it. So through personal experience with a lot of the families, so often our own life experiences and challenges become it just motivates us to create solutions, if you will, to face other similar issues. And so our faith and values, a desire to live out that faith value, we give the families an opportunity to come and sit with us or come to be a part of this program, because the comfort that we have, that the families and the community have in a church. So you have compassion there, you have the service itself, and just a simple love for one's neighbor, if you will. And then the strategies for success and sustainability. It was the clear vision and the mission that the care partners presented to us, developing and having a clear and compelling vision. The families brought into it. They bought into it, and that vision included activities and goals. And we've accomplished quite often 99.9% of them. And then along with that, the community involvement. We also engage the community to give us feedback, because when they go to their doctor's appointments and various counseling sessions, whatever the case may be, they come back with questions, come back with ideas. So we address them in those ideas, and with that community involvement, we bring them all together and present to our volunteers, take it back to our trainers and all that good stuff. And that allows them, that community involvement, the leaders then take ownership of the program. And so when these families see that there's a caring and strong community involvement, they are much comfortable with trusting us, if you will, with their family, and what have you. And then the sustainable funding, the gathering place, as well as other ministries within our church, it's a part of our annual budget. So that helps us. Yeah, it's a part of our budget. And so when we implement those financial management systems with transparency and accountability, these families know that we're for real. We're not asking them for anything. We just ask. It's two parts. Let me explain another aspect of this program. It's two parts. It's for the patient itself, if you will, and also the family members, because the family members, we have training for them, and almost like a AA meeting, not AAA, but AA meeting. And so they're allowed to come together with one another to share their personal at-home experience. And one person experience may be another person answer to a million questions, if you will. And we allow monitoring and evaluation. Although we provide the training and the resources to enhance the skills and knowledge, it's necessary to have an effective program. We allow, again, families to give us feedback. And we take that. And then the public awareness. We raise awareness all the time about this program, and we encourage others to come. And thanks to people such as NMQF and the Faith Alliance Initiative program, the partnership it has it's a very important role there with the partnership. And we'll talk about that probably later, but it's important. So by incorporating these strategies and with the ministries and the programs, we have a strong, it's a strong possibility, that's a positive, let me just say it's a positive impact on the community that we serve, that we ensure that both their success and the sustainability of the program is a great success.
Absolutely. Thank you so much. You were going on about the sustainability, and I didn't quite hear you talk about funds. And I was going to ask, is the church a miracle worker? But then I heard you say something about funds.
No, it's a part of it. If we budget it, we budget it at the beginning of the year. And it's important because these people, not only what we bring into them, to the families, we bring in professionals to train the families, but with the patients themselves, the partners, I don't want to use the term patients, but the partners themselves, they leave with a great lunch during those 4 hours and activity. We bring in various different forms of activity, even on campus as well as away from campus. And during the pandemic, this program did not stop. We took the program into the homes and into the healthcare centers, where so often these families place their family members in these homes because of their schedule, or because whatever the reasons may be, they're not allowed to take care of them at home. So we went into these various homes, if you will, care centers, and continue the program. So that calls for monies.
Yes, absolutely. Thank you so much for pointing that out. Marcia, you talked a lot about trust, about some of the barriers in this space, right? Especially like we talked about social determinants or social drivers of health. How would you, how can these things that you pointed out, how can they be mitigated to improve early and accurate diagnosis for especially underserved populations?
Absolutely. And that's, I think, the loaded question. But you know what? I think it's so important that I think the two things that would always come to mind for me are, number one, of course, education. We need to make sure that we are speaking, like education comes with awareness, right? So education and speaking to people about it. More than anything, number two, normalization. We need to normalize Alzheimer's as an actual disease. I think that, for example, we hear about so many other chronic illnesses, and we experience it maybe in our, circle of friends or family. And if unfortunately somebody receives a diagnosis of whatever it may be, another chronic illness, it's awful, but we acknowledge it and we understand, and we're there to support them while the treatment is happening. With Alzheimer's, first of all, to attain a diagnosis is not always very easy. It's not a one time going to the neurologist. It's several different exams and evaluations. And oftentimes the person that is getting evaluated may not even want to go to the doctor because they may not even believe that there's anything going on or that anything is wrong with them. So there is already a lot going on there. And now to have people, Latinos, African Americans, Asians, that are not necessarily, the first ones that are going in the first early symptoms for early detection. They're going when crisis already happens. This is already probably mid-stage. And at mid-stage, generally the opportunities to join a clinical trial may be past. So that's why early detection is so important, but also because you want to make sure with early detection, and if you find out early enough, we are obviously having time to be able to plan what our long-term kind of care plan will look like. We can be the ones that choose ourselves, or designate who can be the ones that are going to be making those difficult decisions for us as we move along. We have enough time to also, be empowered and enjoy the independence that we still have at that early stage. we can hold on to memories, a little longer. So it's so important, early detection. But with me, I would have to say, going back to your question, Chinnie, normalization of Alzheimer's is important. And that means speaking about it, bringing it to, I'm a big, I would have to say a big speaker for bringing it to even high schools. You can't imagine how many, clients I've worked with that are high school, kids or college age kids that are caring for their parents or caring for a grandparent and, that lives with them. And I, for example, have a mentor that was not able to attend her high school prom because she was at home caring for her mother and grandmother who had Alzheimer's at the same time. So how are we to only speak of this as an aging disease when our caregivers and our loved ones and our families are being affected at such a young age, right? Other clients that I'm working with have grandkids, and they see the grandkids are seeing their grandfather or mother, maybe acting as what they may think is, not normal. And how do we do that? So we need to normalize it and bring the education about Alzheimer's at a way younger age. We need to be able to not feel like we can't disclose it. In our cultures, many times we keep it in our circle and we don't talk about it because we think we can do it all. But at the same time, what is that causing? That's causing major caregiver burden. Yeah.
Thank you so much. Thank you so much. I just want to take this time out to apologize for not being on camera. I'm trying to conserve my bandwidth because unfortunately I'm attending a meeting at the NIH and this network is not so great here. But we see your questions in the Q&A. Thank you. Keep dropping them in. We will get to them shortly. And feel free to use the chat button if you have something to add to the conversation. Augusta, I'm going to go back to you. You said you talked about all the things that the program, the ministry, the Alzheimer's ministry has, and what it offers. In your experience, have you come across either from the patients themselves or their caregivers, what are some common misconceptions, stigmas, myths that you've experienced about people living with Alzheimer's? Marcia talked a lot about disclosing early enough, especially since the caregivers are getting younger because folks have to take care of their grandparents and parents. What are some misconceptions that you have seen in your experience, either with the patients themselves or their caregivers?
As Marcia stated earlier, just the misconceptions has been the statements is just a normal aging. That's not true. Alzheimer's is a specific disease, not a normal part of aging. And it only affects the elderly. No, not true at all. So memory loss is the only symptom. So with these misconceptions through education and basically just training, education, training, what have you, we attack them in a sense, and we create strategies to alleviate these misconceptions, and we try to address and dispel all of them and the stigmas. And so through the support groups, as I stated earlier, our community engagements and the advocacy alone, work with policymakers and share personal stories to humanize this disease. So if we do that, that helps out. That plays an important role. And so often we take it for granted, but we start right in our communities, and we just, especially in the African American and the communities, as well as the Hispanic community, which I'm in the midst of, right? Our congregation, our church is right in the center of. And so with that, personalized care, all of that good stuff, we come into play. And that church is where it's a trusted building, a trusted group of people there, if you will. So often the church has been that trusted beacon on a hill, if you will. And the people come there, and I think the comfort level there for us to discuss these things is just automatic. And the misconceptions of going, not being able to go to a doctor, it's quite often insurance plays an important role, but that's a whole nother conversation because the people just don't have access and in these communities, if you will.
Yeah.
And so that doesn't help a way to improve quality of life in so many ways.
Thank you so much. Thank you. Marcia, in working with patients who and the caregivers who are living with this disease and the burden of this disease, what are some primary health equity concerns that you have seen, and what are some efforts that we can use to address and ensure more equitable access to care and resources for all communities?
Yeah, that's a great question. I think that you know, one of the things that we want to make sure that we are hopefully focusing on is caregiver training. Caregiver training is important. We see the numbers rising in a ghastly way. Right now we have I think approximately like 6.5 million people in the US that have Alzheimer's or a form of dementia. But we have to know that these stats are specifically stats of people that have a diagnosis. How many are there more that are not even seeking out a diagnosis, that are living with it? Again, back to what I was saying earlier, sometimes in our cultures, we don't reach out to the doctors because of trust issues, because maybe they don't speak our language, because proximity, maybe they're far away. You know, if I'm living in New York, I have access to doctors, but if somebody's living, you know, in the middle of the US, it's a lot harder, it's a lot further to get to, you know, these medical facilities, or even wanting to go to a doctor that looks and sounds like us. You know, I am a Latino woman and I experienced this, you know, again, as I mentioned, I was a caregiver. I was one of 4 sisters caring for my mother. And at the time I was not in the dementia and Alzheimer's field. It is because of what happened to my mother that I came to this field professionally. But at the time I didn't know. And I was one of those stats that didn't go, that had caregiver burden, that wasn't even, you know, trying to understand that there is a better way to try to help our loved ones. So I think that caregiver training is important. I would definitely recommend that. That is one of the things that we bring awareness to equally, because the more we can provide, you know, there's so many home health aides and home care agencies that we, you know, refer out to our clients, and we also provide training to these you know, home health aides, because to care for somebody that is aging compared to caring for somebody that's aging with Alzheimer's is very different. And so it's important to know that there is a better way to communicate with persons with dementia. There is you know, so many lessons that we can learn in knowing how to address a person with dementia, by naturally still you know, understanding and respecting them, and knowing that they are a human person, as opposed to speaking about them in the third person, or they're as if they weren't there. Oftentimes I hear many, you know, caregivers, not maliciously, but saying I speak to them like they're a child, because that's what they've become. But we have to remember they're not a child. You know, many times if we're caring for a parent, they're the ones that actually gave us life. They taught us how to walk, eat, you know, use the bathroom, all these things. And now we may be doing that for them, but that doesn't mean that they're a child. They were unfortunately afflicted by a disease. And so caregiver training, definitely. And definitely I would also say just supporting independence, right? In the early stage, we want to be able to also provide that. So it kind of goes in hand with providing them the empowerment, not necessarily, you know, immediately doing things for them, providing that independence and supporting that empowerment that they still can have. Absolutely.
Thank you very much. So I see that we're really, really running out of time, and we have quite a couple of questions.
Sorry.
So no, you're very fine. The conversation has really gone well. There's something that there's another part of the webinar that I think that we need to really speak to, which is clinical trials. Unfortunately, Alzheimer's is not a disease that can be reversed at the time, and there's not a lot of medications or effective medications, I should say, for Alzheimer's. So what would you say about clinical trials? Why is it important to have folks in clinical trials? And I want to use this as an opportunity to address the first question, which is, what is the latest medical advancement the medical field has made in treating Alzheimer's disease as far as slowing down the process, since it's a degenerative disease? Let's talk about that a little bit. Clinical trials. Why is it important? Even though there's not a lot of effective medications for Alzheimer's, why do we talk about clinical trials when we talk about Alzheimer's disease? Please, Marcia.
Chinnie, I think that, without clinical trials, there would be no treatments for Alzheimer's. There would be no possible cures one day for Alzheimer's. We wouldn't know any advancements. I mean, clinical trials are vital. Absolutely. No question about it. I think that, if we're asking if clinical trials are, important or the level of importance, I would say without them, we're not going to advance. We absolutely need clinical trials. Some of the, medications that have come out as of late, I'm sure you're all familiar and have heard of aducanumab. It was approved back in 2021, I believe. And it has just been taken off by the makers off the market. But it's not because of any issues that happened. It was more because of they want to reassess their resources, and they want to relook at what this medication is ultimately going to do. There is a new medication out that's progressive, and there's lots of hope behind it. It's called Leqembi. I definitely have heard of it through many clients and through some researchers that we work with. One of the founders of this program is an Alzheimer's researcher. She's based out of San Diego in California. And we really are hearing lots of positive about it. And naturally, this is a medication that is to be administered in the early stage. The reason, again, that we see the positivity in this is because it does help to, keep the individual with the diagnosis longer in that stage. It's not necessarily to reverse it, not yet anyway. We're hoping for that one day. I'll be happily an unemployed person if there is a cure, but at this point, that is not the case. So this medication will help individuals in the early stage to live longer in that stage. Sure, there's already cognitive decline, but it's not going to advance as fast as it normally can.
Okay, thank you. Augusta, what would you say about diversifying clinical trials, including more people of color into clinical trials? Where does the church stand on this? Is it something you will talk about? Is it something you will promote? Or is it something you don't even find important? How does the church, what's the church stand?
Right. As you know, we're in the middle of one of the world's largest, probably, medical center, and right here in Houston, and we are only less than 4 miles from the medical center. So we're inundated with clinical trials. But as long as these clinical trials are generally supporting medical research, and so often it's supported by some of your partners, MD Anderson, Texas Children, or even Methodist Hospital. As long as it's supported by these organizations, and it gives us an assurance that these advancements these medical benefits or medical advancements will be used over our populations and give us feedback. That's a big thing. What are you doing with this information? We wanted to go into the hands, take it all the way to DC or wherever you need to go to the state reps or capital, whatever the case may be, to change laws and different things. We're a part of it. So we highly, I should say, we highly recommend, or we highly invite these organizations to come to us. But again, is what you're doing with the information, and is it a part of medical research that we could benefit from as well?
Absolutely. Thank you so much. So what I'm hearing is that the church stance is in favor of clinical trials as long as we know what it's for, and it's for the advancement of the folks who are included in the trials. I want to read out a few notes I made for myself while I was getting ready for this, and we'll go to the questions after this. It's the first thing is every patient, regardless of race, should be included or encouraged to participate in clinical trials because it is good science. Drugs are developed for all people of color, and if all people are not represented, then the drugs may not be effective or safe for all patients. Diversity in clinical trials can help fight health inequities. They can lead to more knowledge about diseases and potential treatments for all. So when you participate in clinical trials, you're supporting your friends, your neighbors, and your family. So sometimes the clinical trials may not be effective for you who's in the trial, but ultimately it could be used to develop treatment for a friend, a neighbor, or even your family. So just keep that in mind. And now I want us to, because of time, jump to the questions. Thank you for those of you who have dropped questions for us. Marcia, someone's asking, are your services covered by insurance?
All our services are free of charge.
Awesome.
No insurance is ever asked of you.
Awesome. And do the clients you serve have to have only an Alzheimer's diagnosis, or can they have other forms of cognitive impairments?
Oh, no, absolutely not. They can have any type of dementia or memory loss symptoms, even if their person is not diagnosed, or even if you're not sure if your loved one is, obviously, if they're not diagnosed, if they're just beginning to show symptoms and they have questions, please call the helpline. We have dementia specialists and social workers available to speak to you. They can schedule dementia consultations just to better understand your situation. So yeah, absolutely, it does. It's for all memory loss.
Thank you. And how many stages, someone asked, are there of Alzheimer's?
Is that for me?
Yeah. I'm guessing so.
Sure. So the Alzheimer's Association actually places 7 stages. More often than not, you'll hear early stage, mid stage, and late stage.
Awesome. Thank you. Someone's also asking, Frances is asking how to deal with a family member who rejects their diagnosis of Alzheimer's or dementia.
Yeah, that's actually quite normal in that situation and expected. Generally, the person with dementia may not notice or may not be aware that something is wrong. They generally know that something is not right. They're believing, they can feel and understand something's not quite as it normally is. I can see myself just behaving differently, or I'm frustrated that I can't find the right word, or disoriented in time and place, but they don't actually believe something's wrong with them. So they may have difficulty in going to a doctor because they don't believe that. It's important to be able to have a support system or maybe even some guidance as to how to address that and how to engage them to go to the doctor. I would highly recommend if you call the helpline and we can help you there. It's a little bit of a longer conversation and I don't want to get into that right now.
Absolutely. And we'll be putting up that information very soon. Please bear with us, the helpline that she's talking about for Care in Kind. So you can call. Thankfully, they have services to support remote Thank you, thank you, Anissa. Another question. We noticed that the medication used by a family member, the Persil, is not effective for her. We are concerned about trying other medications because the side effects she experienced previously were severe, including hallucinations and combative behavior. What are your suggestions in this situation? Are some medications more effective for people of color? My family member is an African descent, Black Hispanic, and she's 83 years old.
Again, I think that's a much larger question to disseminate in 3 minutes. And I don't want to take out any questions that maybe Augusta may have for him. But call the helpline. It's not necessarily that one medication will work specifically for African Americans or Latinos or not. It's more the person themselves or the stage that they may be in. So I would definitely recommend that you call the helpline and you can pose the same question and we can help you there.
Absolutely. Thank you so much. And thank you to all of you who dropped a thank you in the chat, in the Q&A. I'm not seeing anything in the chat. But I really want to just take the time out to appreciate everyone who was able to join us in this conversation today, especially you, Marcia and Augusta. Please call the Caring Kind helpline number. Keep in mind what we said about clinical trials. They're important, especially to make sure that the medications that are being developed are effective for all people. But if you're more interested in specific clinical trials or more interested in learning more about specific clinical trials, again, the helpline will be able to answer those questions, or you may speak to your own primary care provider or neurologist, depending on who you see. Again, I want to say thank you. Any last words, Marcia and Augusta?
Marcia? I just want to thank you for allowing me to be a part of this panel today.
Thank you. Marcia?
Thank you. Yes, I just want to say thank you so much. I'm highly impressed, Augusta, with your program. I will definitely be checking that out as well for all and any clients that we may have in that area. And I really just want to say thank you to Chinnie and her team for allowing us to be here today to talk about this really important topic. I think the more that we do this, we are just kind of getting those boundaries out of the way and just trailblazing through. So thank you.
Yes, thank you very much. If you don't mind, before we jump off the call, that's my face, by the way, for those of you who didn't see me earlier. If before we jump off the call, can you all, Augusta and Marcia, put in your information, your contact information, your emails in the chat? So if someone has a question, maybe about your program, how to develop the program in their church, or another question for you, Marcia, beyond the helpline, they can reach out. Thank you so much. Happy Friday and happy Alzheimer's Awareness Month as we step into June. Have a wonderful day.
Thank you very much, you too.